Hello everyone, welcome to another video. So in today's video we'll be looking at one of the most common sexually transmitted disease, and we'll be looking at gonorrhea. So gonorrhea is a sexually transmitted infection particularly caused by a bacteria known as Neisseria gonorrhea, and it mainly affects the reproductive tract, but it can also infect the throat, the eyes, the rectum, and the joints. So it particularly spreads through sexual contact, that is either oral, vaginal, or anal sex, and it spreads through this different kinds of sexual intercourse with when it's done with someone that already has the gonorrhea infection. So babies can also get this gonorrhea from an infected mother during childbirth, and gonorrhea is very common, especially among young adults. So if this gonorrhea is not actually treated, it can cause infertility issues, it can cause pelvic inflammatory disease, and it can also cause like an increased risk of having human immunodeficiency virus, and it also has the risk of spreading like throughout the body. So looking at the reproductive system, the reproductive tract. So this reproductive tract is present in both male and females, and it is lined with mucous membranes which are soft, moist, and they are basically moist tissues that can produce mucus. So Neisseria gonorrhea, the bacteria that causes gonorrhea, it attacks and invades these membranes, especially in strategic locations like number one, the urethra. This urethra is actually the urine tube, is a urine tube present in both male and females. Then the cervix, the uterus, and the fallopian tubes in females, and the rectum, throat, and eyes in some cases. So the bacteria multiplies and it can cause inflammation, pus formation, and tissue damage. So looking at the pathophysiology, so basically after exposure during sexual intercourse to someone that has this gonorrhea infection, the bacteria attaches itself it's attached to and invade the mucous membranes. So the body responds with inflammation, like presence of pain, swelling, redness, pus, and if untreated, the bacteria can spread upward in females to cause pelvic inflammatory disease, and in males it can cause epididymitis, which is the swelling of the testicle tubes. So this infection can also spread to the bloodstream, leading to joint pain, rash, and even heart valve infection in severe cases. So for the causes and the risk factors, number one, having unprotected sexual activity without condoms. Then having multiple sexual partners is another risk factor. Then having a history of other sexually transmitted infections besides gonorrhea. Then also having a new sexual partner that has not undergone any testing, and you don't really know about your sexual partner might be, the kind of infections your sexual partner might be carrying. And also in babies, the infection can be passed from the mother during delivery. So for the signs and symptoms that is seen in gonorrhea, so gonorrhea may not show symptoms in some people, especially women, which increases the risk of the infection spreading in women. So in males, there's presence of like this burning pain during urination, and there's yellow, white, or green discharge from the penis. Then there's presence of painful or swollen testicles, frequent urination, Then in females, they can see signs like vaginal discharge, like it could be yellowish or greenish, then pain during urination, lower abdominal pain, pain during sex or bleeding between periods. And if it spreads, there can be fever, severe pelvic pain, and other symptoms like there can be rectal pain or discharge if the rectum is infected, sore throat if the throat is infected, and red painful eyes with discharge. In this one is seen in newborns that get it from their mothers. So for the diagnosis, basically involves both history, physical examination, and laboratory tests. So a microscopy is done. For the laboratory test, a microscopy is done. Basically a swab of the discharge is stained and viewed under the microscope. So when it's viewed under the microscope, we get to know the kind of bacteria that is causing the infection. And then culture tests too. So the bacteria, they are grown from samples taken from the urethra, the cervix, the rectum, or the throat. Then we also have nucleic acid amplification test, NAAT. So it is a highly sensitive test that detects the bacteria's genetic material, and it is also another laboratory test. Then we also have urine test, which can detect infection in the urinary tract. Then there are some blood tests too, which may be needed if there's a spread, like if the infection has spread into the bloodstream. So looking at other infections that could mimic the same symptoms as we see in gonorrhea. For example, conditions that could look similar to gonorrhea, we have chlamydia, which is another sexually transmitted infection. Then we have urinary tract infections, because with urinary tract infections you also have repeated frequent urination, which is seen in gonorrhea. Then bacterial vaginosis, trichomoniasis, yeast infections, pelvic inflammatory disease, and herpes simplex virus. So all these conditions can maybe mimic the same symptoms that is seen in when a patient has gonorrhea. So for the treatment, basically gonorrhea is treated with antibiotics because it's caused by a bacteria. It's treated with antibiotics, but the bacteria has actually become resistant to many antibiotics. So the treatment guidelines are usually strict now. So the current recommendations as of the latest guidelines involves like injection with a very strong antibiotic like ceftriaxone, a single dose. Then sometimes an oral antibiotic is also added if chlamydia cannot be ruled out, like if the person if it's suspected that the person also has chlamydia, so we can add an oral antibiotic. And it's important that both partners, they must be treated for this gonorrhea infection, even if it's only one partner that has symptoms. Like I said before, in females they are less likely to get symptoms than males. So it might be the man that might be starting to have symptoms, and then to look as if the woman is okay, but it's still advisable that she gets treated too, because it's a sexually transmitted infection. Then it's also advisable that they should not have sex for at least 7 days after the treatment is completed. And then it's also advisable to test again after 3 months post treatment to make sure that the infection is completely gone. So for the management of this infection, it's good to always try to use condoms correctly during sexual activity. Then it's good to also get tested regularly, especially if you are somebody that has multiple sexual partners, or you just engage in sexual intercourse more frequently than the average person. So, or you have a new partner that you're not sure of their history, their medical history. Then also it's good to inform your partner so that they can also get tested and treated. And also try to abstain from sex during the treatment of gonorrhea if you eventually find out that you have this gonorrhea infection. then yeah, try to take the proper treatment, and try to be consistent in your treatment when you actually start taking this going for your antibiotics treatment. So in summary, gonorrhea is a common and serious sexually transmitted infection that is caused by the bacteria known as Neisseria gonorrhea, and it may show no symptoms, but it can lead to infertility and spread to other organs. So if it's left untreated, it can cause more complications, and it affects the urethra, the cervix, the rectum, the throat and eyes. And the treatment usually involves antibiotics, and prevention includes safe sex practices and regular testing. So early detection is critical, and early detection and early treatment is critical in this case when a patient has this infection. So thank you for watching. I see you in next video. Bye.